Good day, everyone! My science experiment is entitled, Do Children That Play Video Games Perform Better in Surgery? As a young child, I was always taken to medical conferences by my parents. This experience made me interested in science and surgery. In the medical world, it has been said that video game players are better surgeons. So I wondered, since kids play the most video games, if kids who are video gamers are good surgeons in the future. The objective of this experiment is to determine if children that spend average to above average amount of time playing video games will perform a designed laparoscopic surgical simulation in a shorter time compared to children that play less video games. The average video game playing time for 8 to 12-year-old kids is about 2 hours per day or 14 hours per week. These are the different variables of our experiment. A 2013 article stated, video game players had better times to complete, with fewer errors, simulated surgical tasks. In 2017, surgical trainees with video game enhanced training had better problem-solving abilities in equipment-related issues in the operating room. Interestingly, a surgical challenge test was done between children and surgeons. The predictable results showed the adults were better than the kids. I present to you the first ever experiment purely on children assessing their surgical skills. Informed consents were obtained. A laparoscopic surgery training box was used. I designed a set of surgical tasks that was age appropriate. A demo video was created. In January 2020, my schoolmates and I performed the experiment. A review of articles was done. From the questionnaires sent previously, data was then gathered. The participants were tested at our schools. We were guided by a qualified scientist to make sure the experiment was carried out properly. My classmates were tested individually. The demo video was shown and instructions were given. The participants controlled the laparoscopic instruments to move objects, thread a needle through a ring, and cut suture materials. The time to complete the task was recorded. The data were tabulated. Computations were made by determining the means, percentages, and percent differences. This is a quick time-lapse video of the tasks the research participants did. The mean age of all the 32 participants was 11.3 years old. The average years of them playing video games was 4.9 years. To answer the objective, there were 12 students who played 14 or more hours per week. There were 20 students who played less. Here are the other data collected. And here are the exciting results from the computations. The older students were 25% faster. The boys were 21% faster than the girls. The left-handed students were 39% faster. The students who played musical instruments were 26% faster. The participants who have been playing video games for more than 5 years were 21% faster. The kids who use more than one type of video platform were 12% faster. And to answer our objective, children who play 14 hours per week were 24% faster surgeons than the others who played less. Further analysis at Yale, using the Wilcoxon rank sum test, showed our primary findings of average to above average gamers being quicker in completing the task almost arrived at biostatistical significance with a p-value of 0.07. And as for the secondary data with their p-values, here is how they relate to speed. The experiment showed average to above average usage gamers were 24% faster than less than average usage gamers to finish the designed surgical task. Our findings answered our research objective. The secondary analysis showed, aside from speed, other factors can affect the completion of the task. These are the male gender, older than the mean age of the study group, left-handedness, musical instrument playing, playing on more than one video game platform, and playing video games more than 5 years. Video games are not only for entertainment. They can be used for surgical training with beneficial results. Surgical skills are affected not only by speed, but this includes properly completing the task with fewer to no mistakes. In the future, I think, surgical simulation experiments should include a scoring system for errors in addition to speed testing. Further analysis of the data was done by our doctor at Yale. The results trends were exciting to see. We need to have a bigger sample size to reach statistical significance. We had fun in doing this experiment with my classmates. I hope this experiment will serve as an inspiration and as a first step for young scientists like us in the field of medicine and surgery. This is our team. This is the background research. I thank my classmates, schools, my principal and teachers, and the parents who supported this research. I thank you for listening. Have a good day.